George Kilpatrick, Inspiration for the Nation. Derrick Murray is the Chief Operating Officer at the Syracuse Community Health Center, a partner with Inspiration for the Nation. And we've got some good news. Vaccinations are available in the community. And here to talk about the plans of the Syracuse Community Health Center and a message for all of us is Derrick Murray. Derrick, good morning to you. What is our message to the community right now that the vaccines are becoming more readily available in the community?
Good morning, George. Thank you for having me on your show. Very happy to report both locally and nationally, vaccines are flowing. And, the commitment that the federal administration has made to increasing both supplies and inventory and manufacturers of vaccine, that's good news for everyone.
Mm-hmm. Yeah, it is good news for everyone. And let's give everybody an update. Like right now, even as we speak, we've learned now that people can get vaccinated in the community. So talk about where people can get vaccinated. I know you're still doing COVID testing at the Community Health Center, from what I understand, but now we're on to the level of vaccines. So what can people do? Where can they go?
So currently, the guidance is that the general public who fit certain criteria can be vaccinated at the county facilities as well as local pharmacies.
Mm-hmm.
And as time goes forward, we feel at the health center that we will be able to also vaccinate the public. And we're working with both county officials as well as the state to give us that permission to vaccinate our patients here at the health center.
Clearly, the patients that you see at the health center are considered to me some of the most vulnerable, and yet there's this feeling that our community isn't being reached, not because we don't know about it, but because there's still this sort of mistrust of the system. Now, I did get a vaccine, and I put it on social media. I let people see that I was getting it because I thought it was important that I use my platform to let people know the importance of doing this. And so let's talk about that, the fact that one of the messages that you're here today to talk about is, especially among the constituencies that you serve, the importance of getting vaccinated, that our community in particular, which has been hardest hit by COVID, how can you alleviate some of those concerns?
So George, as you may remember, I too got vaccinated, and it was on the 5 o'clock, 9 o'clock, and I believe 11 o'clock news. and so as a public health practitioner, I like to practice what I preach.
Mm-hmm.
And the message is that our community does need to be vaccinated. As you mentioned, we have been hardest hit. African Americans have been hardest hit by COVID. And so this is an opportunity for our community to protect itself, but also to stand up and take full advantage of all of the scientific advancements that have been made and protect itself, most importantly.
Yeah, now Derrick, you very public with yours. Why was it important for you to do that?
So as I said before, before the pandemic began, or as it was starting, I was thinking, I actually studied pandemics and how to impact large populations based upon public health. And then we had the pandemic come into play, and I sat with several colleagues, and I may have even mentioned it to you. I studied this stuff. I cracked the textbooks, and I learned about pandemics and morbidity and mortality related to viruses and things like that. And we were in a new world as of March of 2020, right? So it's been a year. And so that experience or that realization that, wow, what I studied, what hasn't happened in the United States since the early 1900s is upon us. And so we had to stand up quickly. We had to put science and expertise into place, but we also had to really put boots on the ground and make sure that people got tested. because testing really helped us identify who was sick, who wasn't, and take the individuals who were sick and put them in an environment where they could get better while not infecting other people. So there's been multiple tiers of attack that we've had during this pandemic that we've had to use against the virus. But vaccines are the tool that we have today, or the weapon that we have today. Now vaccines are going to help us move towards what might be closer to normalcy. It may not
Hmm.
be full normalcy. We
Right.
may still have to mask. We should still socially distance to a certain degree. Still should wash hands as normal. But the opportunity to have families come together, the opportunities to be able to do things that we haven't been able to do will be available to us as we use this tool, the vaccine, to help us fight the virus.
So the message, let me reiterate, what is the message to the Black community in particular?
The message to the Black community in particular is you need to get vaccinated. Uh, any vaccine at this point in time will help you remain out of the hospital and will protect your life.
Hmm.
So the message to everyone is to get vaccinated. And again, the more people who are vaccinated, the better we will be able to control this virus, both locally as well as nationally.
And we should note that there are currently three vaccines available: the Pfizer vaccine, the Moderna, and just out of the box is the Johnson and Johnson vaccine. And now, I guess the state fair, the county, they're doing vaccinations over there as well.
Yeah,
And they're starting a 24-hour location. And I think the overnight is going to be for the Johnson and Johnson, last I heard. So it's just, or at least at the time of this conversation. So there's a number of different pop-up clinics are showing up. There's one at Tucker this week. There's one at the Boys and Girls Club where I went the following week. And so are you eligible? And here's what makes us eligible, because we know that our community has higher risks of diabetes, right? So that makes
yeah,
us, we have hypertension, right? That's,
yeah.
if you Black in this country, you probably have hypertension, because that's just almost a rite of passage, unfortunately, right? And other comorbidities, as they suggest, which opened it up for more people to get vaccinated. And it's interesting because some, Derrick, let's talking with Derrick Murry, COO, Chief Operating Officer, Syracuse Community Health Center. Derrick, there's a conspiracy theorist in our community. Oh, they're just trying to get all of us. Uh, Henrietta Lacks, Tuskegee Experiment. I mean, I got to bring all of that into the conversation because that's what people are thinking about, right? But in spite of all of that, in this particular instance, you and I we both did it because we thought it was important for our community.
But George, I want to point something out. So the Tuskegee experiments, uh, very unfortunate. That was a groundbreaking issue related to informed consent.
Right.
Um, those gentlemen were denied
Mm,
penicillin.
right. Right.
Penicillin was available to treat syphilis. They were denied.
Mm,
This vaccine is being made available.
mm-hmm.
So very different.
Right. 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 Right.
So we need to stress the fact that this weapon is being made available to our community to fight this virus.
Mm-hmm. Which has been deadly, and as you know, has affected many people, including my own family. So one of mental health is also staying connected. Mental health; those are particular issues that we're concerned about in our community. And one of the things that you suggest is that while technology has driven us crazy in many ways, we Zoom all the time. It's also been used to keep us connected to our family. Say more about that.
And George, I know you have family in New York City. I've got family all over the world as well, and so Zoom Duo technology has played a significant role. Now we use Zoom and Team and WebExes and things like that in the course of our work days. Uh, and but I would challenge individuals to use technology to reconnect or connect with their family members,
Hmm.
and 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 that has a double effect, right? So it allows us to have those needed connections and bonds to our loved ones and friends. But it also, if used in that setting, it also adds a certain amount of calming effect when we have to Zoom and WebEx and use these tools in the workplace. So I would just encourage folks to connect with their family members, connect with their loved ones, connect with friends, and and perhaps they have, but continue that. That is one way I know that people are finding outlets during this very stressful pandemic time.
Yes, they are. And I know that the health center, because of technology, you're expanding the way that you're going to deliver healthcare in the community. Talk a little bit more about that.
So there are a number of initiatives that we've rolled out here at the health center. One is really taking care to where our patients are. So we are partnering with community-based organizations using telehealth platform so that as community-based organizations service their clientele, those individuals can also connect to us via telehealth and receive healthcare services. So that's one initiative. The other initiative, which is more general, is our patients who come to the health center regularly may find that a telehealth visit is more convenient, and say it's a follow-up visit to a previous exam. It might be easier for you, George, who's got a busy schedule, to connect with your provider via telehealth as opposed to driving to one of our centers, parking, getting out of your car, getting in, checking in, etc. So we're offering that as a convenience factor for our patients. We're also looking at rolling out a teledental program for the children in the city. Now, the Mother Cabrini Foundation provided us a grant to support that very innovative service where we're trying to reach students and children in Syracuse and provide dental surveillance and other activities so that their oral health can be maintained and we can ensure that they get the care that they need. So we're looking at this in multiple ways on how to reach our patients, because we know that while again folks are getting vaccinated, we need to ensure that there are multiple avenues for folks to get care.
What's your comment about Mississippi and Texas deciding that they're going to go 100% maskless and reopen fully without having everyone vaccinated yet? What's your reaction to that?
Well, so I lived in Texas. My sister was born there, and lived in Texas for a few years. Uh, I, as a public health practitioner, I would not advise it. Um, Clearly, the science is clear that masks work. We know that social distancing works. We know hand washing works. We also have science and literature that says vaccines work. And so I do think that maybe it's a bit premature to lift requirements related to face coverings. But Texas is a special place.
The Lone Star State indeed.
Yeah.
All right. So bottom line here, just circling back, the bottom line here is we're talking about vaccinations. They're available. The more people that get vaccinated, the more opportunities we have to ease restrictions. What's not clear yet, Derrick, and maybe you've heard something that I haven't heard in the last few weeks or so, is after you're vaccinated, will you have to be vaccinated again next year? That's a question that's still uncertain to me.
So that's a very good comment, and so there is literature out there that is purporting that COVID may be endemic, which
Hmm.
which again, separate from being pandemic. Endemic means always around. And so there is literature that suggests that we may have to have an annual vaccination just as we do for the flu.
Mm-hmm.
Uh, there's literature that also says throughout probably the remainder of this year, wearing face masks, continuing to social distance, hand wash, is going to be advisable. But again, the key component is the more people who get vaccinated, and you mentioned it earlier, the sooner restrictions may be able to be eased.
Derrick Murray is the Chief Operating Officer for the Syracuse Community Health Center. They're a partner with Inspiration for the Nation. And we'll be hearing more from the Community Health Center in the coming months about some of the activities and physicians and programs that they have for our community. But for people who want to take advantage of the healthcare needs in the community, how do they get a hold of you all?
So as always, they can access our website, they can call us, and our number is 315-476-7921. They can schedule an appointment in that fashion and also hear about all of our services.
Derrick Murray, Chief Operating Officer for the Syracuse Community Health Center. Thank you.
Thank you, George.